Every month, millions of women look down and see something that stops them in their tracks. A clot in their period, of course. And most of them do one of two things. They either panic completely or they tell themselves, this is just how my body is. This is normal for me, and they carry on. Both responses can be wrong because period clots are not all the same. Some are completely normal, some are your body telling you something important, and some, the ones most women dismiss for years, are signs of a condition that is quietly affecting their fertility, their iron levels, and their quality of life. Today, I'm going to teach you how to read what your body is telling you every month through your period. That is what I'm going to do today. Okay, before I proceed, real quick, and I checked my analytics, and 98% of you are watching without subscribing. And of course, you know who you are. I would like to ask you to hit that subscribe button, tap the bell, and drop a comment telling me what topic you want me to cover next. I read every single one. Are you done with that? Perfect. Just to remind you, I'm Dr. Libeya, your pharmacist, and this is the kind of conversation that most women deserve to have with their doctor, but rarely do. Let us change that today, and so let's begin and dive into the discussion of the day. I would like to begin with the basic science, because understanding what clots are, they make everything else make sense. During your period, your uterus sheds its lining. It sheds the endometrium. This lining, along with blood, it passes out of the body, and your body, being the intelligent system it is, releases natural anticoagulants to keep the blood flowing smoothly. To prevent excessive bleeding, your body releases anticoagulants, and of course these are substances that keep blood from clotting. However, if blood flow is heavy, these anticoagulants may not work fast enough, and this leads to clots. Think of it like a river. When the river flows at normal speed, everything moves through cleanly. But when the flow suddenly becomes heavier than normal, the water slows in certain places and it begins to pull and, of course, to thicken. That pulling is what forms a clot. Period blood clots are gel-like lumps of blood and tissue that pass from the uterus during menstruation, and that's just a simple definition. They can vary in size from small flakes to larger quarter-sized lumps. And here is the key point. The size of the clot tells you a great deal about what is happening in the inside. And here is your simple, practical guide to knowing what is normal. Small clots, this is roughly the size of a grape or smaller, or on the heaviest days of your period. They are completely normal, they're expected, and nothing to worry about. Menstrual flow with blood clots that are as big as a quarter or larger is considered heavy menstrual bleeding, and it warrants medical attention. We talk about a quarter, or in local terms, roughly the size of a 10-shilling coin. That is your line or a red flag. If you are regularly passing clots larger than that, particularly if it is happening multiple times per day, that is not normal variation. That is a symptom. And here is the question I want you to ask yourself, and ask yourself honestly. How long have you been passing large clots and telling yourself it is just how your body works? Because I have met women who have been doing this for 5 years, for 10 years. Women who did not know that what they were experiencing was not normal, because nobody ever told them what normal was. Today, now you know, and I expect you to do better. Now, let us talk about the underlying reasons, because large, frequent period clots do not happen without a cause. And knowing the cause is the only way to actually fix the problem. Number one cause is fibroids, and this is the most common cause of heavy clotting in women, particularly those of African origin. Now, heavier bleeding is common with fibroids, and that can make you more likely to pass clots during your periods. Fibroids are non-cancerous growths that are found inside or on the uterus, and they're extraordinarily common, affecting up to 70% of women by the age of 50, with Black and African women experiencing them at significantly higher rates and at younger ages than other populations. Now, fibroids increase the surface area of the uterine lining, meaning more lining to shed, more blood, and more clots. Now, some women with fibroids are passing clots the size of their palm and changing their pad every 30 minutes. And they have been told or told themselves this is just how their periods are. It is not. Fibroids are diagnosable with a simple ultrasound and they are treatable. Number 2 is endometriosis. Now, this tissue responds to hormonal changes just like the uterine lining. It can swell, it can break down and bleed with each menstrual cycle, causing inflammation, scarring, and pain as well. Heavier bleeding is common with endometriosis. Endometriosis is a condition where tissue similar to the uterine lining grows outside the uterus, on the ovaries, on the fallopian tubes, or elsewhere in the abdomen. Now, every month, that tissue responds to hormonal signals. It swells and bleeds with nowhere to go. The result is heavy clot-filled periods, often with severe cramping that goes far beyond ordinary period pain. And one of the most dangerous things about endometriosis is how long it takes to diagnose, an average of 7 to 10 years globally, because pain has been normalized, because clots have been normalized. Do not normalize yours, please. Third is hormonal imbalance, including thyroid disorders. Now, thyroid disorders and perimenopause can alter menstrual flow and clotting significantly. Both an underactive and an overactive thyroid disrupt the delicate hormonal balance that governs the menstrual cycle. The result is often heavier, more irregular periods with larger clots. Now, this is one of the most frequent missed causes of heavy period because nobody thinks to check the thyroid when a woman complains about her period. But a simple TSH blood test can identify this, and thyroid disorders, once treated, often dramatically improve menstrual symptoms. The other cause is polyendocrine metabolic ovarian syndrome, and this was initially known as PCOS, and it has been renamed by the medical community. That was in May 2026 to PMOS. It causes hormonal disruption that leads to irregular, often very heavy periods when they do occur. The prolonged buildup of uterine lining between irregular cycles results in heavy shedding with significant clotting when menstruation finally begins. The other cause is bleeding disorders. If you have a bleeding disorder, your treatment may include special medications to help your blood clot. Now, we have what we call von Willebrand disease, which is a condition affecting the blood's ability to clot properly and is actually far more common than most people realize, and heavy periods are frequently its first and only symptom. Many women with this condition live their entire lives without a diagnosis, simply managing heavy periods with no explanation at all. Now, beyond the inconvenience and the discomfort, I want to talk about what consistent heavy clotting is doing to your body over time. Heavy menstrual bleeding is common. It affects anywhere from 27 to 54% of people who menstruate, and the most direct physical consequence of losing that much blood every month is iron deficiency anemia. When you bleed heavily, you lose iron, and iron is what your body uses to make hemoglobin, the protein that carries oxygen in your red blood cells. Without enough iron, your blood cannot carry adequate oxygen, and you feel it every day, not just during your period. The fatigue that never fully goes away, the brain fog, the breathlessness, climbing stairs, the pale appearance that you could be having, the nails that break too easily. Many women live with chronic iron deficiency anemia caused entirely by their periods and never connect the two. They take iron supplements without addressing why they keep losing so much blood in the first place. The supplement treats the consequence, not the cause. That is what many women fail to understand. Here is exactly what I want you to do. As your pharmacist, I want you to do this. First, track your flow. For your next 2 to 3 cycles, pay attention. How many pads or tampons are you soaking per hour on your heaviest day? Keep track of that. Are you passing clots larger than a 10-shilling coin? Keep track of that. Are you flooding through protection overnight. Write it down. This information is what your doctor needs when you pay them a visit. Secondly, see a doctor and ask for specific things. Ask for a full blood count to check for anemia, a thyroid function test, that is TSH, ask for it, a pelvic ultrasound to check for fibroids and assess the uterus if maybe there could be a problem there. Now, these 3 investigations will give your doctor the information needed to find the cause of your heavy clotting. Thirdly, do not dismiss your pain. Do not. Period pain that requires you to miss work, to miss school or daily activities is not normal. Don't normalize it. Pain that does not respond to ordinary painkillers is not normal. If this is your experience, please use the word endometriosis with your doctor. Ask for it to be considered when they are conducting the test. Fourthly, manage the anemia while you address the cause. Heavy bleeding can lead to anemia. Include iron-rich foods like spinach, lentils, and lean meats in your diet. If a blood test confirms iron deficiency, your doctor or pharmacist can recommend the appropriate iron supplementation alongside dietary changes. But please, treat the source of the blood loss as well, not just the deficiency that it creates. Fifth, know your treatment options. It's important to know your treatment options. If clots are due to an underlying condition, your doctor may recommend hormonal birth control, pills or intrauterine devices to regulate periods, or NSAIDs like ibuprofen to reduce bleeding and cramping. For fibroids, treatment ranges from medication to minimally invasive procedures to surgery, depending on size, location, and your fertility plans as well. For endometriosis, hormonal management and in some cases surgery are options that the doctor could consider. For bleeding disorders, specific medications exist to help the blood clot properly. There's always something that can be done. There's always something that can be done, but only if you seek the correct diagnosis. Don't use shortcuts, use the right route. Let me leave you with this. Your period is not something to be endured in silence. It is a monthly report card from your reproductive system. And clots, particularly large ones, are that report card telling you something needs your attention. Small clots on heavy days, that is normal and it is expected. Clots larger than a 10-shilling coin, soaking through protection every hour, periods lasting more than 7 days, pain that stops your life, fatigue that never lifts. These are not just how your body is. These are symptoms, and symptoms have causes, and causes have treatments. Share this video with every woman in your life who has been telling herself her heavy periods are normal, because the most important thing I can give you today is permission. Permission to take your own symptoms seriously. Drop a comment below. Tell me, how long did you dismiss your period clots before finding out there was an underlying cause? I genuinely want to hear from you. Subscribe if you have not yet already. Tap the bell and I'll see you in the next video. I'm Dr. Libeya, your pharmacist. Bye for now.